Very much for a very warm welcome. Assalamualaikum warahmatullahi wabarakatuh. Very good morning to you all. Yeah. Okay. I've already listened the two previous presentations, which highlight the adaptations that have been conducted in Brunei Darussalam as well as in Malaysia. So what I would like to share with us today is the probably again our experience in Faculty of Medicine Universitas Indonesia, and also reflecting the adaptations of different medical schools in Indonesia, as well as some probably offering some thoughts to for our future reflection. So let me share my screen. Okay, so this is the title of my sharing today: Medical Education Beyond the Pandemic: Reflections for the Future. And we have shared a lot, and I think we have been reflecting a lot on the past before the pandemic, and I think different institutions in different countries have already attempted, for example, in the curriculum adaptations, in teaching and learning, as well as in assessment. And probably during the COVID-19 pandemic, we still have the pandemic at the moment in different conditions after 2 years. But then probably it's time, it's pertinent for us to think about what we would have for the future. Because change is inevitable, of course, and probably the pandemic has strengthened a lot of efforts in using the online learning, which has been with us for quite a long time, actually, but we must admit that we haven't really used that optimally until the pandemic hits us. And then we had no choice, and we moved to something that we can do, which is the online learning. So in regards to that, then my talk will probably again reflect on what we have done in terms of how we adjust the learning outcomes, how we try to adjust also the content, the teaching learning methods, the assessment, the learning environment, and also the student and also staff support that have been done during the pandemic. And in discussing that, I would like to also offer probably some current evidence and literature around that, and for us to think for the future. So regardless the pandemic and whatever the condition that we are in, all medical schools around the world have the same responsibility to produce medical graduates who are fit for practice. So this is the thing that our institution needs to think and to strongly hold, in order for us to, okay, we adapt this and that, and then it doesn't mean that we jeopardize our responsibility to produce medical graduates who are fit for practice. And understanding that responsibility, it means that we need to again use our knowledge on the knowledge, skills, and attitudes that needs to be achieved by our medical student and probably our medical residents. And during the pandemic, we thought a lot about whether we need to really prioritize certain outcomes for us to redefine what does it mean by fitness for practice. So what we did was we really in different programs in our institutions, in undergraduate and postgraduate, we did the remapping of expected learning outcomes as well as the competence, and defer the process if necessary, and again also reflect on whether it will influence the length of the study. And our decision was not to add the length of the study, but we reprioritize what kind of competence that really build the fitness for practice for our medical graduates. It means that we need to also use the opportunities to enhance other learning outcomes on the professional development. This is some examples that during the pandemic, our medical students and our medical residents, especially during the first 3 months, they did a lot of activities to help each other in providing the personal protection equipment, for example. And a lot of our undergraduate medical students also did study on their willingness to volunteer and to help the frontliners in our country in facing the COVID-19 pandemic. And at the same time, we do realize that the unprecedented times and also the impact towards the medical educations, we did discuss about the changes and the adaptations in the preclinical and clinical year teaching. We then also thought about whether it would influence the students' professional identity formation. And this is one of our studies really trying to which really tried to explore the professional identity formations of our medical students and how they cope with the pandemic and how they adapt in terms of they acknowledge their feeling, the risk, and also the opportunities, the learning opportunities, despite all of the limitations and adaptations to the shift in teaching and learning processes. And more importantly, if I can direct your attention to the third themes coming from this study, is the students' perceived role as medical students during the pandemic, that they become more aware their role as community health educators and role models, becoming the good citizen during the pandemic, roles in serving the community. And at the same time, they also explain the professional dilemma in fulfilling the perceived roles during the pandemic. For example, the clinical year students, they do understand they need to master the clinical skills, competence, and at the same time, they do realize that they had very limited opportunities to learn and to master those kind of skills. So they have also the professional dilemma. In trying to remapping the learning outcomes, we do understand that we cannot stop only at a certain stage or certain level of medical educations. If we are in the undergraduate medical educations programming, for example, we need to still make sure that, okay, if we have the redefinitions of the fitness for practice for our graduates, then what happens for our graduates in our institutions? What happens to the graduates from all different institutions in the same country, in Indonesia, for this instance, and whether it will influence the postgraduate program later on, whenever these graduates coming to the residency program. And it will need to make us think further what further support can be given to these graduates having their clinical year, especially during the pandemic. Whether in terms of the colleges and etc., we need to provide the continuing medical education and continuing professional development. So the remapping of the outcomes will have impact on how we see the continuous process of undergraduate, postgraduate, continuing medical education, and continuing professional development. This is coming from our reflections, and whenever we try to do the curriculum mapping and etc. in our undergraduate medical program, we try and it's continuously done to also communicate and advocate to different stakeholders to see this together, at least in one country. Second is adaptation in the content. We do realize that the pandemic also introduced a lot of subject content which might not have been covered well in our undergraduate medical program or even in our postgraduate medical program, in terms of the social aspects of the pandemic, for example, the specific contents on COVID-19, pandemic preparedness. We don't know whether, we hope that this is the last the pandemic that we face, but probably we need to also prepare for the future. Health education and risk communications, ethical dilemma, and again, strengthening our understanding in our curriculum content on evidence-based practice. So it was also the pertinent time to revisit our curriculum content and again reprioritize what content that needs to be implemented or it needs to be delivered in our curriculum. So this is one of the example. We use our elective module slot in our clinical year for students to be involved really in the COVID-19 pandemic response in DKI Jakarta, where the Faculty of Medicine and Universitas Indonesia resides. And the medical students then were trained and their capacity were developed to be involved as the first responder for the patients isolating in their home. So here the students learn about the patient-centered care, the doctor-patient communication in special situation, clinical decision-making, ethics and professionalism, system-based practice, technology use, and again, the resilience and agility. And they become the part of the community approach during the pandemic, and it was coordinated also by the Health District Office in DKI Jakarta and collaborating with our medical school. The third is, which has been discussed a lot in 2 previous presentations, in how we adapt with the teaching and learning. We use a lot the online learning as well as the simulations, and there's this scoping review explained that around the world that this has been done by different medical schools and health professions education school. And at the same time, we do realize that we use Zoom, for example, as the virtual synchronous learning, and at the same time, we realize that we need to also add further content for students to also have the self-directed asynchronous learning and even the collaborative synchronous learning. We developed the massive open online course for our graduates and our medical students, so that we hope that it can be implemented parallelly with the current curriculum implementations, because we do realize, especially during the first year, that in our curriculum there's no specific content on COVID-19, for example. So we need to add that in our curriculum by having more flexible way to learn, by providing the student with a massive open online course, and probably not fully massive open online course, such an online course which allowed them to learn self-paced, and at the same time they can also ask to the resource person on the provided synchronizations. So during the pandemic, harnessing this appropriate use of technology really becomes one of the highlights, I think, of our adaptations, e-learning, the applications, probably the massive open online course, as well as the simulations. Again, all of this have been there for quite some times, and during the pandemic we need to really strengthen or probably use more of this. And this is this coming from our clinical year, where the students, during whenever the pandemic can be controlled in a certain level, we allowed our students to come to the clinics, to the hospitals, and they have with very limited number of medical students coming to the for the bedside teaching, doing the bedside teaching, and the rest will join through online. So they still have the experience indirectly of doctor-patient communication, and they can still discuss that afterwards. And again, in our teaching hospital, there are a lot of measures to be which were done to support all of these adaptations. And we also realized that it's not easy for students to navigate all of the changes and the change of the learning environment coming from the offline to online, or then to the hybrid or blended learning. And we realized that we need to also make sure that our students are ready to navigate all of the learning opportunities, and not only they know what the aims, they also can use the resources for different things. And we realized that evaluate the self-regulated online learning of our medical students are also important. Number 4 is the adaptations of the assessment. Probably I will not explain in details how we did that, because I think it will echo what have been presented in the 2 previous presentations. But this is the highlight from the literature on the adaptations. And again, the challenge is really to still provide the valid and reliable and impactful assessment despite different adaptations that we've done. And we realized that it has become more important to provide the multiple data points for our medical students, not only from 1 or 2 summative assessments, but from longitudinal assessment, for example, through the e-logbook or the portfolio, or even from the progress test results. And this is from the literature that it's time for us to rethink our assessment in terms of why we're doing the assessment and how we're going to do that, still prevailing the validity as well as the reliability as well as the learning impact of the assessment. How can we still be doing the assessment which are authentic, and how we can navigate the use of technology around assessment. Number 5, which I think we sometimes take this for granted, that everyone can adapt well. This really comes from our own reflections, and one of our colleagues and the students did the study on the relationship between online learning environment and medical students' well-being. And this is very interesting because even though medical students generally enjoyed online learning, and it was positively associated with students' well-being, some students expressed negative emotion, including loneliness, anxiety, anger, and sadness. And this for medical students. We haven't done studies around staff, but anecdotally, actually, the medical staff, our support staff, have also been feeling the same. And we are really crying for help to get supports, which we usually got from our peers whenever we come and we see each other in our school. So it's not only about still fulfilling our aims to for students to still fulfill the expected learning outcomes, but also it becomes more prominent the need to also support them emotionally, especially in terms of the whole well-being, not only for medical students but also the medical staff. And whenever we discuss all of the safety and the well-being, and we learn a lot about the wisdom when to contact our colleague and when not to contact our colleague, that everyone has their own struggles, and how the technology probably becomes the way for us to interact. But at the same time, we tend to have no limits in our working hours. That's also introduced another issue in trying to preserving the well-being. And this is the easy way that has been introduced for these past 2 years, and we've discussed this a lot with our medical students and our medical staff, that focus on things that we can control and optimize ourselves, and then we are reminded that we also need to also take care of ourselves. So in navigate all of those challenges, we have these key questions if we would like to move further. What must continue after this pandemic or during this pandemic, past 2 years, almost 3 years of the pandemic? What can be postponed, but we still need to happen as is? What can be adapted, changed, or remediated? What can be dropped or minimized? What needs to be added? And the resource person from the second presentations from University Kebangsaan Malaysia, thank you very much. You highlighted very important teamwork behind all of the changes and all of the adaptations. And I believe that adaptive leadership is very much needed in these situations, probably in the future unseen challenges that medical schools will face. And we've been doing the study, it's in progress for publications, that exploring what's beyond the pandemic. And the study highlight the importance of coming back to really enriching and evaluating the student-teacher relationship and the trust, because all of the changes of learning environment makes us having different ways of relating and communicating with the students and with each other of the medical staff. It means that probably it will be impactful for the meaningful learning, the sense of social identifications, identity forming, as well as the resilience. And the self-awareness, self-regulations, and motivations becomes more critical for us as the medical school to really incorporate in our medical curriculum and make sure that our medical students have the resilience and have the self-regulated learning skills. And of course, the social skills and building a leading team, and the leadership and the environment and the system, which pro for innovations and also for change. What's for the future? Probably this is not all, this is not exhaustive and comprehensive, but I think coming from different literature is building trust, the student, faculty, patients, doing the co-creations, make sure that all of what we've done, we are doing are still relevant and purposeful, using the best evidence in medical and health professions educations, including whenever we use technology, and still analytical and creative. And lastly, bounce forward. I think it's we don't have any other choice rather than bounce forward, use the technology wisely, give opportunities more for our students to be more responsible for their learning, develop our teachers, become highly skilled and can engage students better, and still in our curriculum resulting future ready and safe practitioners for quality healthcare. So to end up my presentations, I think I would like to just introduce this question for us all. what's beyond this pandemic? What will be our value and norms? How can we see probably and reflect the way we teach, learn, and assess, the way we develop a relationship with our students, and the way we help and treat our patients, or even the way we live. With that, I would like to thank you very much. Assalamualaikum warahmatullahi wabarakatuh.